The healthcare detective Frank Lalli has written a book for Simon & Schuster about how to get affordable healthcare. Called Your Best Healthcare Now, it is available online, in-store, wherever fine books are sold. Mr. Lalli is also the health correspondent for Parade and the former editor of Money and George magazines, which should tell you that he watched the debate last night and the night before. This is being recorded on Friday.
That's correct.
Friday, the 28th of June, and I am going to say, hi, Frank, how are you? So now it's time-stamped, it's everything, and you would have to sort of be totally asleep, which we are not, to not talk about, quote, Medicare for all, quote, and, quote, universal health care, quote, unquote.
And socialism, quote, unquote.
Socialism,
which all came up. So, 2 nights of debate, and only a minority of candidates, Democratic candidates, these 20 people running for president on the Democratic side, only a minority of them raised their hand and said they were for Medicare for all if it meant that it was the only health care in the plan on this earth in the United States, and you would have no private insurance. Okay, so most people, 80% of people get their insurance at work, and in a very strict Medicare for all proposal, that becomes the Medicare plan for the whole country. So you would not get your Medicare, you not get your medical care and your health insurance at work any longer. And that is a big hurdle for an awful lot of people. So I think it's really interesting. The people who said yes, they raised their hand and they would go full out for a government health care plan were the most, in this sense, most progressive, the most to the left. So it's only a handful. There's Bernie Sanders, that's his chief calling card. There's Kamala Harris, who had a very good debate and is now going to be surging. It's also Elizabeth Warren, who is cutting deeply into Bernie Sanders and may even pass him soon, and de Blasio. So why are they positioning themselves out that far, and what are the consequences of it? So here's where we stand now today. For crazy historical reasons, okay, back in the 50s, when, frankly, bosses didn't want to give workers raises, so they gave them benefits. They started to cover their health care. And I remember in my family, this was great. You can actually get a job, and a job comes with benefits, and the benefits was health care, which was rare in those days. So that's the way we delivered. Instead of a government plan like a Medicare for everybody, we just sort of stumbled into this plan where if you got old enough, you got a government plan, or if you're poor enough, you got a government plan called Medicaid. Otherwise, you got your insurance at work if you can work for a company that offered health insurance, and if you kept your job, because if you didn't have that job and you go to another job and they don't have health benefits, that became a real problem. So that worked for a long time, but we know that in the last 5 years, these costs of these programs have just skyrocketed. Corporations spending a tremendous amount of money providing the health care, and as a result, they're cutting back on that benefit, and they do it this way. They force the workers to put more money in, so the deductibles go up, their co-pays go up, and then you've got prescription prices on top. So frankly, getting your insurance at work is nowhere near as popular as it used to be, and it's more expensive than it used to be. And though 70% of the people say, yeah, I like my health insurance at work, it's a very soft 70%. So along come the progressives who say, look, on top of all that, you got something like 30 million people, close to 30 million people who aren't insured at all because of the company they work for doesn't have health insurance, or they're working for themselves, or other reasons. And that's not the way it should be in this country. Basic health care should be a human right. It's not a privilege if you can afford it. Every other industrialized company makes it available. So let's come up with an idea that provides Medicare for everyone. So it's pretty simple. It's pretty simple. If you wanted to do it, in a day and a half, you would just rewrite the Medicare law and say, instead of having to be 65 years old to join Medicare, you can join at any time. Okay, follow me so far? See where we are in the debate?
Yeah, so far that's eminently workable, it
Right.
would seem.
Okay. Now we hit the problem.
Yes.
This costs money. So Bernie Sanders says, okay, let's imagine you're a family and putting in something like $12,000 a year, which is kind of an average expense for healthcare for a family in this country. Let's say you're spending $12,000 on your healthcare that includes all your copays and your deductibles and everything else. If we had a government program, your cost would go down to $7,500. Okay, so you're going to save $5,000. The problem is the $5,000 you're going to save, this $7,500 that you're now going to spend rather than writing a check to a doctor, that's going to be in the form of higher taxes. So what is happening here? I'll give you free Medicare, but your taxes are going to go up. Now, hold on. At the end of the day, you're going to come out ahead because you're going to be not paying any copays, and you're actually going to be $5,000 to the good. And hey, by the way, all your bosses at work, that's going to cost you, you're going to go from $12,000 to $15,000 to cover your employees, and you're going to go all the way down to zero. You're going to save $9,000 in real dollars for every employee you have. We go to a Medicare for all. But there's a headline here. I'm raising your taxes. And I'm not only raising your taxes, I'm raising your taxes $3 trillion a year. And I'm not only raising your taxes $3 trillion a year, that's the largest tax increases since World War II. Now, it seems to me, Republicans are going to be able to really come up with powerful ads against Medicare for all. So why are these candidates standing out there, and these handful of candidates, and they're viable candidates, why are they standing out there and saying they say, look, this is the only way we're going to get to universal health care. It's what we need to do. Now, they're opening themselves up to real attack ads and attack ads that really can sink them when they get out of the primaries and get into the general election, where people are reminded, oh, yeah, that program, that's going to raise your taxes more than higher than since World War II. All right. There's a pivot to get out of it, and I think a lot of candidates are going to use the pivot. But there's also history to take into account. So, Jill, you may remember the Willie Horton ads. You remember the Willie Horton ads?
I do.
The revolving door? Okay.
I'm old enough.
Yeah. Okay. For the younger listeners, okay. George Bush, Daddy George Bush, Poppy Bush, sunk Mike Dukakis, because Dukakis had a program that had furloughs for criminals. So you get a weekend furlough if you were being a good prisoner. And it didn't really work, okay? And in one or two of those cases, or more of those cases, the furloughed prisoner committed more crimes. In one case, it was an assault, a burglar robbery, and a rape by one person named Willie Horton. All right. This issue came up in the primaries, the kind of debates that we're having right now with the Democrats. And it was raised by Al Gore. And Al Gore said, hey, you have this weekend furlough program for criminals. Is that really a good idea? And Dukakis said, well, it doesn't, that's okay, I guess. And that was that. It didn't
okay,
really
I guess.
register. Yeah.
Like those, there's a series of adverts for just okay is not okay.
Just okay is just not okay. Bush's team sees this, and the guy named Lee Atwater sees this, and he says, holy moly, we've won the election. I've got this Willie Horton case. He looks into it. They put Oppo people on it. And there's this Willie Horton case. He's out on a furlough, and he commits crime and rape. So obviously, let's hang that around Dukakis' neck. So they did an ad, a very famous ad, where Willie Horton, right, who's black, goes out of prison through a revolving door. Here comes all these Willie Hortons. This is this softy Dukakis. He's not fit to be president. And Dukakis gets creamed in that election. There are people out there saying the same thing could happen to Kamala, to Warren and de Blasio, because they're going to take that one instance here that comes up in the Democratic debate And then when we get over to the election, they're just going to run ads about the highest taxes since World War II and $7,000 new dollars in taxes for every family in the country. And they're taking away your insurance. You got insurance at work, 80% of them do. Among the voters, 98% of likely voters get their insurance at work. Okay, only 2% don't. So they're going to say, they're going to take away your insurance. They're not going to give Medicare for all that doesn't even exist. They're just going to take it away. All right, what's the answer? Here's a thing to look out for. And it came up last night, actually, from Gillibrand, Kirsten Gillibrand. She said, okay, here's the way we're going to do this. We're going to transition to Medicare for all. So for 4 years before we go to 100% Medicare for all, we will have a public option. This is something Obama tried to get for the Affordable Care Act. The Democrats and the health insurance companies fought it like crazy and killed it. All that really means is, you know what, worker, you now have a choice. You can continue to get your insurance through work, or you can sign up for Medicare, or if you're making too little, Medicaid. You can sign up for the government program at any age. That will be a glide path to universal for all. I think that's very appealing. I'm giving the American people now a choice. You like your insurance at work? Okay, but you may have noticed that those deductibles keep going up each year and your benefits go down. They're not covering these heavy costs of these drugs for you any longer. Every year it's a new bad news memo from the HR department about your insurance. So, okay, you still like it? Stick with it. If you don't like it, how about enrolling in Medicare? You know how well that's working for your parents? Okay, I think that's a big winning argument. And I think you're going to see every one of these, with the exception of Bernie Sanders, who's a true believer on Medicare for all, and that's the only answer, I think you're going to see every one of the other Democratic candidates pivoting from Medicare for all. Yes, it's aspirational. It's like the Green New Deal. We want to do it. But along the way, we're practical. So first of all, we're going to give you this public option. You can sign up for Medicare or Medicaid, and that's your insurance. If you like it at work, stick with it. Otherwise, we've got this wonderful government program that seniors love. So that's the way I see it. That's the way I see it going. The other word you're going to hear, Jill, is socialism.
Well, for that,
anything the Democrats say, the public option will be, this is going to be socialism. Let's get socialism. Let's get socialism clear, okay? If any of the candidates were saying, we will now take over all the hospitals and doctor operations in the country. We're going to nationalize them. Every one of those people become employees of the United States government. The way it works in Britain, that's socialized medicine. Nobody, but the Republicans screaming it. Nobody believes, and I don't think the Republicans believe it either, that's socialism. Nobody is suggesting that. Nobody, except the Republicans who are exaggerating.
Well, we have a minute.
Distorting.
We have a minute left, so I'm going to interject by simply saying the socialism argument is pretty easy. You could just say Social Security is socialism. That's the definition here of socialism, and that could be over in about 96 seconds. So I don't think that is. I mean, you could waste a lot of time and brain cells under, or use one of my favorite George W. Bush words, misunderestimating the voters.
Overestimating. Yeah, because listen, they've been screaming socialism since the Republicans, since Social Security. But that is not going to stop them from doing it, and you see them. They're doing it already. They're saying these candidates are trying to turn America into Venezuela. No, they're not. No, they're not. They're trying to provide better health care to everyone. They're trying to cover those 28, 30 million people that don't have insurance at all, and they're trying to give workers a better alternative to the insurance they have at work, which is getting worse by the day. There was this Fox, as it was Pete.
13 seconds.
Mayor Pete. Yeah, okay, in 30 seconds. Mayor Pete goes on the Fox show, and he's talking about these ideas of government insurance, or a way to get the government insurance, or a public option. And the host turns to this Fox audience and says, how many of you would give up your private insurance at work for a government program, right? Every hand went up.
Right. No, we saw that. Definitely saw that.
People say, I like my insurance at work. But I'll tell you something. It's not what it was 5 years ago. It wasn't what it was 3 years ago. It's getting worse because it's getting more expensive. And sooner or later, we'll have the public option, I believe. And the public option may indeed lead to Medicare for all. But we're probably talking about 5, 6, 7, 8 years from now. Meantime, public option, great idea. You're going to see the Democrats pivot to it. And I think it'll diffuse what could have been a Willie Horton moment for some of these Democrats and turn it into a positive one.
Thank you, Frank, the healthcare detective and the health correspondent for Parade. Send your questions or concerns about finding affordable healthcare to healthcaredetective@robinhoodradio.com. Frank will try to address as many of your questions as he can on future broadcasts. Also, look for his book, Your Best Healthcare Now, available online, in stores, and on my desk.